morning, everyone, and welcome to today's session, Transitioning from ICD-9 to ICD-10. My name is Michelle Polis, and I'll be your organizer for today. Before I turn the presentation over to the actual presenters, Arlene Dunphy and Alicia Forbes, I would like to briefly review with you some of the features of this webinar product for those of you that have not attended this type of session. Although it's not required for participation in today's session, attendees may wish to download the PowerPoint presentation that we will be using today. Just please note that the instructional slides that I'm going over right now are not available for download. So today's presentation is located on our website at www.ngsmedicare.com under the Training Events calendar. And this is where you originally registered for today's session. So shown by the arrow here, on the start page of our website, you want to click on Training Events Calendar. And that will bring you to this next page where you're going to choose your business type. So you want to click on Part B. And then once you're in the Training Events Calendar, you want to scroll down to find today's session and then click the link for the session to be brought to the Events Details page. Now you have different ways that you could locate your training events, our webinars. You could use the advanced search on the left-hand side and just key in the date, or you could also key in a keyword. Okay, so if you just placed ICD-10, all the sessions would come up. So what you want to do is just click on that link shown there by the arrow, and then that will bring you to the Events Details page. And then as you can see here, the attachments for this event is on the box on the right-hand side. So you could download that, save it to your desktop, and then you can just print it out, and you could use it for a later resource. So once you click that, this is how you can print it out. And some of our presentations are very lengthy. So what you can do is choose the multiple pages per sheet option under the page scaling. Okay, so you want to use the drop down here, and then you could print however pages of sheet you'd like to print out. So you may print out 2 pages, 4 pages, or 6 pages per sheet instead of that 1 page per sheet, which is the default option. Okay. So now to briefly review some of the features of the GoToWebinar product before the actual presentation begins. This session is scheduled to last for 90 minutes. And it will include a question and answer session at the end of the presentation. Okay, so right now we're looking at an example of the GoToWebinar attendee interface, which is made up of 2 parts. You have the viewer window on the left-hand side and the control panel. Okay, so the left-hand side, the viewer window, is how you'll be able to see everything that the presenter is sharing. That's your presentation there. And then on the right-hand side, this is how you're going to participate in today's session. So let's take a look at that. So to listen and ask your questions verbally using your telephone, you want to make sure that you click on Use Telephone. Okay, and that's noted here. And then you need to enter on your telephone. You're going to enter the telephone number, the access code, and then you have to make sure that you enter your audio PIN. Okay, otherwise you'll be able to hear us, but you won't be able to verbally ask your question. If you use microphone and speakers connected to your computer to listen and ask those questions, just remember that while most laptop computers have built-in microphones, most desktop computers do not. We've also noticed that some attendees may be able to hear us during the webinar through the mic and speakers. Your laptop may not be equipped for you to ask a question through the mic and speakers. So at that point, you may want to type your question in the question box, and this is how you can do that. So again, you have the 2 options to ask your question, send your question through the question box. So you're going to enter your question here and then click Send, or you can raise your hand to ask the question verbally. Okay, and that's done here. We just ask that you do not do both at the same time. Okay, so if you raise your hand but then change your mind or your question has been answered, Click on the raise hand button again, and this will lower your hand and take you out of the Q&A queue. You will know if your hand is raised if the arrow is red, and if your hand is lowered, the arrow will be green. Okay, so that's right here. Okay, the green arrow will indicate that your hand's not raised. Once you click on that little button, the red arrow, right, it's pointing down. Okay, this indicates your hand is raised. And then if you want to lower your hand, you're just going to click that again. Okay, so before I turn the presentation over, I'd like for you all to just take a quick poll. Okay, give me one moment. Okay, so if you just take a couple of seconds, if you could just take this poll for us so that we know which state your practice is located in. And we'll just give you a couple of seconds. Okay. All right. Okay, and then let's just close that out. Okay, and then you should be seeing the results there. So we do have 53% in Connecticut or New York. Okay, 18% in Massachusetts. We have 5% in New Hampshire or Vermont, 6% in Maine or Rhode Island, and then 19% in other states that are not listed above. Okay, so this just gives us an idea as who is attending our session today. Thank you for taking that. Okay, and now I'm going to turn the presentation over to our first presenter, Arlene Dunphy. Arlene?
Okay, thanks, Michelle. Just give me 1 second to bring up my screen. Oops, okay. There we go. Good morning, everyone, and welcome to the Transitioning from ICD-9 to ICD-10 webinar. This presentation was designed to give you a brief overview of the steps you should take to make the transition from ICD-9 to ICD-10. This transition to ICD-10 will be a major undertaking for providers, payers, and vendors, and it's going to drive the business and system changes throughout the healthcare industry, from your large health plans to small provider offices, laboratories, medical testing centers, and hospitals. So it's really important that you devote staff time and financial resources to the transition activities. The transition will go much more smoothly for those organizations that do plan ahead and prepare now. This slide is just exactly what Michelle went over. If you have not went and got the presentation for today, this is how you can obtain the presentation. You want to use it for while we go through the webinar today. As Michelle said today, your presenters are myself, Arlene Dunphy, and Alicia Forbes. We're both with the Provider Outreach and Education Department of National Government Services. And we also do have additional staff on the line to assist with the answering questions session of the webinar today. This slide is our standard disclaimer slide. This you will see in every presentation that we do, whether it's a webinar or face-to-face or any other educational event that we offer to you. So it's just letting you know that we do strive to give you the most current and accurate information with every presentation, but as part of your responsibility as a Medicare provider, you need to keep current with the program changes. So we do recommend that you visit the National Government Services and CMS websites to stay current with all those changes. And you should also sign up for both the National Government Services and the CMS listservs, which are also known as the email updates. Please note that we do not permit any recording of our sessions, and this does apply to our webinars, teleconferences, live events, or any other type of educational sessions that we offer. And as Michelle and I both stated, you are able to view, print, or save this presentation we're going over today, so you always have that to refer back to. On slide 6, we provide you with information where you can locate the acronyms used in today's presentation. So you'll see them spelled out first, and then you'll see the acronym used. So if you want a complete listing of that, you can always go out to our website at www.ngsmedicare.com. you can click on your line of business on our homepage, and then you'll see a toolbar on the right-hand side, and you can click the Resources tab. And under that drop-down menu, you can choose acronyms, and those will be listed for you in alphabetical order. Or you can just click on the link on your slide today where it says acronyms, and that'll bring you directly to there as well. Our objectives for today is just understanding the ICD-10 changes, how it differs from ICD-9 and why it's important. The implementation of ICD-10, conversion strategies, and suggested resources we'll give you. Our agenda, so we'll just go through what is ICD-10. So we'll give you a little background of ICD-10, why it's relevant to physicians, so why it's important to your office to change over to ICD-10, what steps you should take to transition to ICD-10, and what will change for you. And then we'll give you some resources, as I said, and we'll take the questions and answers at the end of the presentation. Okay, so let's start with what is ICD-10. ICD-10 is the 10th revision of the International Statistical Classification of Diseases and Related Health Problems. It's a medical classification listed by the World Health Organization, and it codes for diseases, signs, symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or disease. ICD was published by the World Health Organization, which directs and coordinates health authority in the world. And ICD is used worldwide for morbidity and mortality statistics, reimbursement, resource allocation quality, and guidelines. In the United States, we will be using ICD-10-CM. This is a variation that was developed by the National Centers for Health Statistics, and it was developed with a great deal of input from technology advisory panels, physician groups, and coders across the United States. ICD-10-CM will contain approximately 68,000 codes, and this is a much higher level of specificity, and it's necessary in the United States because of our higher requirement for data, specifically for the specificity of data that we use in our payment and reporting systems. As you can see here, ICD-10 is not new. Most of the world has adopted ICD-10 over the last 2 decades. The United States continues to use ICD-9, which was published more than 3 decades ago and used for morbidity data and Medicare and Medicaid claims. The U.S. remains one of the only developed nations in the world still using ICD-9, as you can see from this slide. Just a comparison of ICD-9 and ICD-10. ICD-10 is an enhanced or mature version of ICD-9. Its most notable differences compared with ICD-9 is that it more accurately reflects current medical practices. ICD-9-CM, which was originally published in 1977 and adopted by the U.S. in 1979, has terminology and classifications that no longer fit with the current healthcare system needs. So it no longer reflects advances in medical treatment and has limited room to assign any new medical codes. So without being able to assign a new medical code, a new medical discovery, the healthcare system would not be able to track and study these advancements across a large population. So some differences that you will see from the ICD-9-CM to ICD-10-CM is that ICD-9 was printed in a 2-volume set as compared to the ICD-10 3-volume set. Your ICD-10 will contain alphanumeric categories rather than strictly numerical categories. Some chapters have been rearranged, titles have been changed, conditions have been regrouped, forming 21 chapters, which is almost twice as many categories as ICD-9. And there was also minor changes to the coding rules for mortality. Slide 12 talks about some benefits of ICD-10. Using the new system will significantly improve the capture of information for our increasing complex healthcare delivery system. ICD-10 will provide greater coding specificity for hospitals, physicians, payers, and others within the healthcare system to support accurate payment. It will include an increased number of codes and categories, allowing for specific and accurate representation of current and future medical diagnoses and procedures. An accurate coding will reduce the volume of claims rejected due to uncertainty. The new code set will also improve operational processes across the healthcare industry by classifying details within codes to accurately reflect patients' conditions and improve payment processing and reimbursements. It will also streamline payment operations by allowing for greater automation and fewer payer-physician inquiries. And it will provide more detailed data to better analyze patients' disease patterns and track and response to public health outbreaks. Okay, slide 13. ICD-10 is a requirement, so the transition to ICD-10 is not optional. This transition will affect all covered entities as defined by the Health Insurance Portability and Accountability Act of 1996, which we know is HIPAA. So it will be used by all providers in every healthcare setting. It will also include providers and payers who do not deal with Medicare claims. When ICD-10 is implemented, the ICD-10 CM will replace the ICD-9 CM volumes 1 and 2 for reporting diagnoses, and ICD-10 PCS, which is the procedure code system, will replace ICD-9 CM volume 3. The claims for all services and hospital inpatient procedures performed on or after the compliance deadline must use the ICD-10 diagnosis codes and inpatient procedure codes. Claims that are received without the proper coding will not be able to be processed in the system. So the compliance deadline for ICD-10 CM is October 1st, 2014, and that is effective for dates of service for your diagnosis codes and date of discharge for your inpatient procedure codes. Okay, so again, it's a date of service for your diagnosis codes and date of discharge for the inpatient procedure codes. And also want you to note that the switch to ICD-10 will not affect your current procedure terminology and health common procedure coding system codes. So your CPT codes and your HCPCS codes are not affected by the change to the ICD-10 PCS codes. Okay, the ICD-10 PCS codes, the procedure coding system codes, are for hospital inpatient procedure codes only. Okay, so just to be clear, the ICD-10 PCS is for inpatient procedure coding, and it's not replacing the CPT or HCPCS codes for reporting procedures and services in an outpatient setting. Okay, so we just spoke previously on this slide about who the transition is going to affect. This slide is just providing you just a list of entities that will be affected by this transition. So it's anyone who's covered under HIPAA, so your healthcare providers who conduct electronic transactions, payers including Medicaid and Medicare, clearinghouses, and then also some non-HIPAA covered entities that currently use ICD-9 codes. So that includes your vendors and business associates of covered entities, workmen's compensation programs, life insurance companies. So although these entities are not bound by HIPAA, they will be affected by the change to ICD-10. Since ICD-9 will no longer be maintained after the compliance date, it's really in the non-HIPAA covered entities' interest to transition over to ICD-10. Okay, slide 15, let's talk about the electronic transactions. To process ICD-10 claims and other transactions electronically, providers, payers, and vendors must have first implemented the version 5010 electronic healthcare transaction standards mandated by HIPAA. The previous version, the 4010, the 4010A1, did not support the use of ICD-10 codes. So the changes to the 5010 version included an increased field size for ICD codes from 5 bytes to 7. It added a 1-digit version indicator to the ICD code to indicate version 9 versus 10. It also increased the number of diagnosis codes allowed on the claim and included additional data modification in the standards adopted by Medicare. The National Uniform Claim Committee also made revisions to the CMS 1500 claim form to accommodate the ICD-10 codes. And there was a MedLearn Matters article, MM8505, that was posted to our website on January 24th. And it listed the information that's here for you on slide 16. So the new version is 02/12, and that new version was accepted in our systems as of January 6th of this year. And we will continue to accept both versions, so your 05 version and the 02112 version up until March 31st, 2014. But then come April 1st, we'll only accept the revised version, which is the 02/12. Okay, so that'll be the only form accepted at that point. Okay, so currently we are accepting both forms. Come April 1st, it will only be the new form. Okay, slide 17, we start talking about the testing week. So hopefully everybody's already had a chance to look at this information that was posted on our website. So the National ICD-10 Testing Week is an opportunity for trading partners, software vendors, clearinghouses, and billing services to come together and to test their ICD-10 compliance efforts already underway with the electronic data interchange. And CMS does encourage all the software vendors, clearinghouses, and billing services to participate in this National Testing Week. The testing week will give the trading partners access to the MAC and the CEDI for testing with real-time help desk support. The testing support hours will begin Monday, March 3rd through Friday, March 7th. And we'll talk more about that on the next slide as well. The link here on slide 17 does provide you the link that you are able to register, and you only have a few more days to do that. Registration ends on the 28th, as it's noted here. It was open from February 2nd to February 28th. So if you're interested in that, you can click right on that link on the slide, and you're able to register for testing for that week. So just additional information on testing. If you're going to test and you've already registered for it, the testing claims will include the ICD-10 codes, and they must be submitted with a current date of service. So it has to be from October 1st, 2013 through March 3rd of 2014. All the test files must be submitted with a T and the ISA 15 test production indicator. The test claims will receive the 277CA or the 999 acknowledgement. Any production files that we receive with an ICD-10 code, those will be rejected. Okay, and then the support staff will be available for you from 8 a.m. to 5 p.m., and that's Eastern Standard Time. And we list for you on the slide the phone number for the support staff. Okay, so let's talk about the dates for the freezes. ICD-9 Coordination and Maintenance Committee implemented a partial freeze of the ICD-9, CM, and the ICD-10 codes prior to the implementation of ICD-10, which would end 1 year after the implementation of ICD-10. So the last regular annual update to both ICD-9 and ICD-10 code sets were October 1st of 2011 and October 1st, 2012 and 13. There were only limited code updates to both ICD-9 and ICD-10 code sets to capture new technologies and diseases. On October 1st, 2014, there will only be limited code updates to the ICD-10 code sets to capture new technologies and diagnoses. And note that there will no longer be any updates made to ICD-9 at that point. Okay, and again, this is effective for dates of service, October 1st, 2014 for your diagnosis codes, and date of discharge for your inpatient procedure codes. And then October 1st, 2015, that's when regular updates will start being made to ICD-10. Okay, slide 20, we talk about your local coverage determinations. Okay, and this was another MedLearn Matters article, MM8348. And all ICD-10 LCDs and associated ICD-10 articles will be published on the Medicare coverage database no later than April 10, 2014. All other LCDs and articles not attached to an LCD will be published in the Medicare coverage database no later than September 4th of 2014. So any articles or LCDs that have ICD-10 codes in them that have to be changed over, that will be done by April 10th. The ICD-10 LCDs and articles will receive a new LCD or article number. However, although the new number will be assigned to the LCD, they will not be considered a new policy if the only change in that LCD was to transition the codes from ICD-9 to ICD-10 codes. If there are any other changes that were made to that policy besides just adding the ICD-10 codes, then it would have to go through the normal process of a policy up for review. So just keep that in mind. Okay, slide 21, just why is ICD-10 relevant to physicians? There's one primary reason. ICD-10 codes are necessary for claim submissions. So if you do not have ICD-10 codes on your claims in the future, you'll not be able to submit claims, and therefore you will not be able to receive reimbursement. So that makes it critically important. But you do have actual benefits to ICD-10. First of all, ICD-10 will allow for more accurate reimbursement. In the current code set, the degree of illness or severity cannot really be captured. However, in ICD-10, it does make it easier for that information to be captured. ICD-10 codes will also allow for faster claims processing. Many audits and payment policies are based on information that cannot really be captured within the current code sets. So those claims often need to be suspended for manual review. ICD-10 will allow for more information to be captured within the code set, which will allow for more automatic processing of those claims. So they would not have to be suspended in our system for an actual person to review that claim and review the documentation. The third benefit is actually for the patients. ICD-10 codes allow us to capture more information about the patient and the diseases that those patients may have, and this will allow for improved research in the future. There's also a cost for non-action. So if we do not move over to ICD-10, we will be stuck with the limited code space that exists in the ICD-9 because there's always new diagnoses and degrees of disease. The new codes have been placed in the ICD-9 code set wherever space is available. So this results in code families being fragmented. Parts of one diagnosis may be in one section, and they may have to skip to another section to find a similar diagnosis. It makes it more difficult for the coders and the physicians as they're trying to code the claims, whether it's for claim payment or for research purposes. Okay, so let's talk about the differences in the codes themselves. The most obvious difference is that ICD-10 uses alpha characters as well as numerical. You're probably used to seeing in ICD-9 the 3-digit code, a period, and then up to 2 digits following. Okay, with ICD-9 it could be up to 7 digits. With ICD-10, most of the positions can be alphabetical or numerical, and that's noted for you here. I'm just going to highlight it for you. Okay, so over here, your first digit in ICD-10 is always an alpha digit. Your second digit is always numeric, and then your third through seventh digits can be alpha or numeric. Okay, also listed here for you, laterality. Okay, ICD-9 does not define right or left. Okay, however, ICD-10 does. Okay, so you'll see different codes assigned in the ICD-10 book. You'll have additional codes for the right side or left side. Okay, but just because the ICD-10 codes will indicate left or right, that does not mean that you're going to change your billing patterns, okay? For your CPT modifiers, your RT and LT modifiers, those are still valid modifiers and those still would be used. If you use them currently, you would still use them. Okay, this slide shows you the difference on how injuries are structured within ICD-9 versus ICD-10. In ICD-9, your injuries were grouped together by the type of injury. While fractures were in one section, dislocations in another section, and sprains and strains in another section. In ICD-10, they've been reorganized. So you have all the injuries to the head, injuries to the neck, injuries to the thorax, and so forth. Okay, placeholder X. We all know in ICD-9, as I said, your codes can be between 3 and 5 digits. And not all the codes require that 4th or 5th digit, so you wouldn't add extra characters or extra digits or a 0 to make that code 4 or 5 digits. The same holds true for your ICD-10 codes, but ICD-10 uses a placeholder of X. Okay, and that will fill in the empty characters when a code is less than 6 characters in length and it requires that 7th digit. So the first example is listed for you here. This code requires a 7th digit, so it's W11 period XXXA. So this means fall on and in ICD-10 means and or from a ladder. The 7th character is an A, and that indicates that this is the initial encounter. Okay, so this code did not have a 4th, 5th, or 6th digit, but it did require that 7th digit, so the X's were used as placeholders. Other times, the placeholder X can be used as a 5th digit placeholder with certain 6-digit codes to allow for future expansion. So we have an example for you here as well. Example is T36 period 0X for your 5th digit 1, and this is poisoning by penicillin accidental. Okay, so that's the X is there to allow for that future expansion of that code. Okay, also in ICD-10 CM, it provides you with 2 different types of excludes notes. So you have an exclude note 1, and this will indicate to a coder that the ICD-10 codes that should never be coded together. These codes cannot be reported together because the 2 conditions cannot occur together. Okay, so an example of this is E10 for type 1 diabetes mellitus. You'll see under the exclude note 1, E08 for drug or chemically induced diabetes, or E09 for gestational diabetes. So you would not be able to assign the E10 code for type 1 diabetes with an E08 code for diabetes due to an underlying condition. Okay, then it also has excludes note 2. And these are conditions that are not included in the code that's listed. So this excludes note 2 indicates that the condition excluded is not part of the condition represented by the code, but the patient may have both at the same time. An example of this is L89 for a pressure ulcer. If you look up L89 in your ICD-10 book, it has an exclude notes 2 for diabetic ulcers, non-pressure chronic ulcers of the skin, skin infections, and varicose ulcers. So the patient could conceivably have types of ulcers those types of ulcers in addition to the pressure ulcer. So if they do, it's okay to assign the other codes with the other kind of ulcers in addition to the L89 code for the pressure ulcer. Okay, let's start talking about transitioning to ICD-10. So we know why we're transitioning, because ICD-9 has limited data about patients' medical conditions. It has outdated and obsolete terms, and it's inconsistent with current medical practices. And we do know it's not optional, and all covered entities must comply by that October 1st, 2014 date. So let's just talk a little bit about what needs to be done. Okay, when thinking about the transition to ICD-10, keep in mind that the size of the practice largely determines the amount of planning and effort that will be required. Small practices will have a simpler transition because the procedures that are involved in ICD-10 are relatively limited. The responsibility for the transition will primarily rest with the physician and the coder. Medium-sized practices are slightly different. Some medium-sized practices operate like small practices, therefore the transition will be similar to the small practice transition. However, some medium practices can also operate more like large practices. They have a larger software investment, they have more office staff that support the physician. In those cases, the medium-sized practices will transition using a process that's more like that of the large practice. Your transition roadmap consists of 6 phases on slide 28. The first is the planning phase, so you'll need to figure out what you're going to do and generally how you're going to do that. The second phase involves communication and awareness. This is more important in larger groups. In smaller groups, it really involves getting your staff together and discussing your current practice and what you'll need to change. The third phase is the assessment phase. So you're going to try to work out more of the details, such as where is ICD-9 used currently and where ICD-10 will be used in the future, and what changes your practice will need to be made. A simple approach to that, to the practice assessment, is to follow the patient through the office from the time they make their appointment until the visit is billed, so you know exactly what steps need to be changed through that whole process. The fourth phase is the operational implementation. So how do you actually go from today's world to tomorrow's world in a step-by-step fashion? The fifth phase is your testing, and again, we already talked about that in that MLN Matters article, MM8465, talks about the testing that is currently available. And then the last phase is the transition. This slide is a copy of the ICD-10 timeline posted on the CMS website. This gives you a great idea of where you are and where you should be. So if you go out to CMS's website, click on Medicare and then ICD-10, you'll see this timeline as well as checklists for all size practices. So there's a lot of helpful tools out on Medicare's, out on CMS's website, and I believe Alicia will take you out there at her part of the presentation. Okay, this is your transition roadmap for small practices. The small practice roadmap, as I said, is shown here. The planning and communication phases are both combined for the small practice because communication should be less extensive in a small practice. Most of the effort should go towards planning, followed by the assessment. Then you'll move on to the actual steps of how you're going to make the transition and then transition. For your medium-sized practices, the process may be a little bit more complex because you may have to get more employees involved. You may have groups that work in different areas of the office. You may have functions that are separated in your office. So you need to make sure that those different groups within your office are coordinating and communicating with each other in order to get this transition done for ICD-10. Okay, let's talk a little bit about the project plan. In a small office, you do not need to develop a formal project plan in the way insurers, payers, or the way CMS or hospitals or large groups would. In a small practice, the primary individual who will work on the ICD-10 transition will be your office manager and your coder. To figure out how you're going to approach the project, you'll need to determine how the individual physician is involved as well. In the small practice, it's most typically an individual physician in the practice. So they are involved not only as the user, but the person who sees the patient and has to have that clinical information coded, but also as the owner of the practice who needs to make sure that the business works smoothly. Training needs. You do need to assess the training needs for your staff, which staff members will be involved with ICD-10 in the future. So primarily we're talking about the physician, nurse practitioners, physician assistant, office staff, coders, and the office manager. So the actual training time will vary depending on who needs the training and what training they're actually going to need. And the time to train your staff is usually about 6 to 3 months before they will start using ICD-10. You'll also need to consider the appropriate training methods for your practice, whether it be a webinar, certification courses, or community courses. And a lot of them are already out there and available. If you just look it up, if you just Google it, you'll be able to find training courses that are available. And we expect more will become available as we approach the deadline for ICD-10. Your training should be relevant to the clinical and administrative staff. Most of the training is going to focus on the code sets themselves, but it may be necessary to look at and learn some new options in information technology. In a small practice, the information technology is provided primarily by your vendor. And then other parts of the training will center on the documentation itself. Slide 35 just talks about your vendor evaluation. Small practices typically do not build their own software. They purchase the software from vendors, and they have agreements with those vendors where the vendor provides the software that is used in the claim submission or other administrative transaction, and it's the vendor that has to keep the software up to date. So you really just want to make sure that your vendor is prepared and ready for the changeover to ICD-10. We list for you on slide 36 just some sample questions that you may want to ask your vendor. You need to know if they're going to have some sort of mapping between ICD-9 and ICD-10 code sets, if there's going to be changes in the system. So if there are changes in the system, are you going to receive any training? Are there new hardware requirements? Is going to be a charge for that? So just a sample of questions that you can ask them. If you are looking for a new vendor, we ask that you ask the same sort of questions to them, but you have additional questions here that you may want to find out if you're in the market for a new vendor. Successful transition will depend on coordination with staff, payers, and outside services. We list for you some challenges regarding internal and external parties. May include inadequate or untimely staff training. So we went over that, how important it is to get your staff trained. Loss of a key vendor, I discussed that as well. If you're in for a new vendor, if you're in the market for a new vendor, there's questions you can ask, or ask your current vendor what process they're taking to get ready for ICD-10. Loss of key staff, lack of payer readiness, or budget limitations. So you do need to budget for these changes. Other parts of the monitoring your transition is to keep track of what's happening on a day-to-day basis. Prior to the point of transition, you'll need to make sure that you have updated your forms and your super bills, and Alicia's going to talk about that, arrange for appropriate staff training, and order books for your coders. As of the date of transition, you want to very carefully watch the claims that are going out and the payments that are coming in to make sure that your payments continue on schedule and seem to be continuing at an appropriate rate. For internal monitoring, this mainly involves working with your coder to make sure that there are no issues with the ICD-10 codes. Physicians will also need to work with their industry leaders to make sure that accountable care measures and other quality measures are appropriately updated. And this is going to be where your specialty groups will become particularly helpful to you. Specialty groups can help you with not only the measures of quality, but also with ways that you can focus on the particular codes that are most important to your specialty. So specialty organizations sometimes can provide you with cheat sheets or cross-references, lookups, or other things that may be helpful to the transition that will apply to your specific specialty. So make sure you are in contact with your specialty societies. And post-implementation, it's going to be important that you work with your vendors to ensure that they have delivered as they promised, that there's no disruption on your claim submissions or your payment flows. You'll also need to work proactively with your vendors to review problem areas and recommend solutions for resolving those problems. Finally, you want to look at the practice recommendations, to review processes to confirm effectiveness and sustainability. And we list them there for you: clinical documentation changes, coding practices, any revenue cycle processes or changes. Okay, just want to make sure that you are looking at all that information after you transition over. Okay, and that does conclude my portion of today's webinar. I'm going to turn this now over to your second presenter, Alicia Forbes.
Thank you, Arlene. Okay, let me just get my show the presentation. There we go. All right, thank you, Arlene. Okay, now what I'm going to do is I'm going to briefly review a sample project plan on the following slides. These slides are examples of what you may need to do in each department of the practice. Now, in your manager's office, the office manager will need to review and they will need to update any policies and procedures that pertain to ICD-10. Vendors and payer contracts will need to be evaluated. They will need to be contacted if necessary to check to see if they'll be ready for ICD-10 as well. The training needs to be provided, such as ICD-10 coding or training on new software updates. The office manager will need to make sure that those expenses are in the budget. Now, for a training plan, you will need to determine how much and how you will get it done. You start the conversation with your vendors, as Arlene had said. Talk to your vendors now to make sure that you can count on them to have your fully functional, compliant product and the services ready in plenty of time to allow for that testing that Arlene had mentioned. Help you avoid potential reimbursement issues and interruptions to workflow. Ask your vendors to establish a comprehensive approach that will deliver compatible products when you need them. Make sure that you find out whether there are any system upgrades, what the costs are involved, when upgrades or new systems will be available for testing, customer support and training that they will provide, and if there is any cost to that, and how their products and services will accommodate, this is very important, both ICD-9 and ICD-10 as you work through those claims during the transition dates. You know, claims prior to October 1st and then claims after. Until all of the claims prior to October 1st are resolved, your vendor's software will have to accommodate that. Talk to your vendors now about how it will help you ensure that your transition goes smoothly. Now, the clinical area will need to evaluate all the payer policies, such as with LCDs, with Medicare. Okay? Now, you have to, if you have pre-printed ABNs that have ICD-9 codes on those will also have to be updated. Let's look at the difference between here, the super bill, as Arlene had mentioned. Okay, now your super bill is used so that you can quickly complete and submit the procedures and the diagnoses for the patient visit reimbursement. I'm pretty much probably all familiar with this. It's customized for your office and contains patient information, the most common procedure codes and diagnosis codes that are used in that office. About half of the ICD-9 codes on this super bill are usually general codes such as unspecified or not otherwise specified. These general codes exist so that all the information encountered in the medical record can be assigned a code. Now, with ICD-9, a lot of times you have to use an unspecified code because there's nothing more specific. But with the granularity of ICD-10, you probably will be able to find a more substantial diagnosis. Okay? ICD-9 it lacks the specificity necessary. So the documentation in the medical record should you may have to put more emphasis on the documentation so that you can get a proper ICD-10 code, and you should advise your clinicians of that, and they should be aware of it. Well, they should be putting in their medical record, you know, what exactly was done and to what area or body part. Okay, you should probably be able to find a code in ICD-10. Now, here is an ICD-10 super bill. As you can see, it went from like 2 sheets to like 8 sheets or 7 sheets here. Okay, now CMS has published what's called general equivalency mappings, or you might have heard of them called as GEMs, or crosswalks, that relate each and every ICD-9 code to one or more ICD-10 codes. Now, we use these crosswalks to convert each ICD-9 code on the super bill on the previous slide to its equivalent in ICD-10. In some cases, the crosswalks were incomplete, okay, and conversion to ICD-10 actually produced far less clinical detail than had been provided by the original ICD-9 code. It is important to always look up the code in the ICD-10 book for the most detailed code that can be linked back to the documentation in the medical record. Now, since ICD-10 has a greater specificity, documentation will need to be more specific as to what Arlene had mentioned earlier, the laterality, the stages of healing, the specific body part, like say upper arm instead of just arm. That's how specific ICD-10 codes are. And the physicians must be trained and informed and trained in the greater specificity of ICD-10. Now, at the nurse's station, okay, there may be changes to forms. Now, anything within that nurse's station, if any of their documentation has ICD-9 codes, they have to be converted to ICD-10. And nurses also, as well as physicians and also non-physician practitioners, will need to make sure to document with the greatest level of specificity. Things like prior authorizations, those also may change. And that would be with like other insurance companies. Now, the laboratory. make sure that when you send specimens to a laboratory that you provide that laboratory with the proper ICD-10 code, or else they won't be able to bill their services. Now, the billing department, well, ultimately it comes down to the billing department. And if all the other departments are properly trained and all the forms and procedures in the practice are properly updated, the production in your billing and reimbursement will not suffer delays. So it all comes down to that billing. And with the coding department, since, again, ICD-10 is more detailed, the folks in the coding department, they need to have an extensive knowledge of anatomy and medical terminology, and that will be required with the increased specificity and more codes. Now, our front desk, okay, any privacy policies that forms that you have must be revised, and the patients will may need to sign new forms. Systems updates will likely be required, and it may require new ways of handling patient encounters. So keep all of that in mind when you're updating, your office to ICD-10. It's a large undertaking. Now, what I want to go over with you, I would like to mention many of the resources that are available. I would particularly like to refer to you to the website for the Center of Medicare and Medicaid Services. What I'm going to do is I'm going to go out to our website. And under the Department of Centers for Medicare and Medicaid Services, you see here, is it changing? All I see is the resource slide. Oh, there we go. Okay, now on CMS's website, what we want to do is we want to go into, this is the home page. You type in cms.gov, see here in my address bar. We're going to click on Medicare. Okay, and on the left-hand side, we're going to scroll down, and under coding, we have ICD-10. And this is where you'll find, look at all this, okay. This is a 4C survey that popped up on the screen. I don't know if you can see that yet. Oh, there we go. Now, this just popped up on CMS's website. We have one of these on our website as well. If this pops up, we would like you to click on yes, I'll give feedback. We would really like you to do that. But right now, I'm going to click on no thanks. And as you see here on the left-hand side, we have the latest news with ICD-10, which is what this page is right here, and all sorts of resources. Now, we also, on our website, on ngsmedicare.com, and we type that in our browser, and then we are Jurisdiction K. So we're going to click on Jurisdiction K. Okay. A lot of folks are using our website today. Okay, we'll see if that comes up. I'll go back over to CMS's website while that's loading. Okay, we have a lot of resources available to you. CMS has a lot of resources available to you. Okay, first here, it gives all information about ICD-10 and where it came from. It's covered under the Health Insurance Portability and Accountability Act, or HIPAA. Now, as Arlene had mentioned, and we get this question a lot, is it going to affect my procedure codes? No. CPT is not changing. So only the diagnosis code. Now, what we want to do is we want to go to physician, okay, here on the side, we want to go to resources, provider resources right here. And here we have understanding the basics. You want an introduction. This is all introduction information. Implementation guides, timelines, and checklists. Here is an online ICD-10 implementation guide. And here, what we mentioned on our slide, okay, ICD-10. I'm going to go into all of these. Okay, here are the resources here. We have all, the CMS has all different books, ICD-10 implementation guides for large practices, for payers, for small and medium practices, and for small hospitals. And you can find those guides on CMS's website, okay, for large practices, small and medium practices, and small hospitals. Timelines, and here are those implementation guides right here. You see, here we go. Now we're on ngsmedicare.com, and we have, you can locate this information from a few different areas. Right here on our self-service center, right here under a hot topics, and that is a hot topic, is ICD-10 implementation. Okay, and here we have on our website, we have here countdown to ICD-10, 216 days. So what we're going to do is we're going to highlight here. We're going to go to ICD-10 implementation. Again, we have our countdown. Okay, we have important information regarding National Testing Week, which is next week. Okay, so if you haven't signed up for that, please sign up for that if you would like to test. Right here, National ICD-10 Testing Week registration. You just click on that link and sign up to be one of the testers. A very easy form to fill out. Now here that we have the benefits of ICD-10, as we know, excuse me, it gives more specific clinical data for research and to better support what's in your medical record. We have our compliance date, and as far as CMS is concerned, this is set in stone. It's not changing. And then we have frequently asked questions. We scroll down, and then we have related contact. These all go out to CMS's website. All the related MLN Matters articles, a lot of them Arlene had referred to, and MLN Matters fact sheets. These are all from the CMS website. And if you go to our website and transfer over to, it'll transfer you over to CMS's website, so that, you know, CMS's website is Medicare, Medicaid. If you come to our website, it will link you directly to the resources that you may need. Now, one of my favorite resources is from the American Academy of Professional Coders. I'm going to click on that and show it to you. What this does, okay, let me just get my papers away from the phone so that they don't crinkle on you. Okay. Now, here on AAPC's website is a very good tool for you to use. If we go here to ICD-10, and then we click on ICD-10 conversion, it will bring us to this neat ICD-10 code translator. Now, what this code translator does, what I had mentioned earlier is we have those GEMs, those general equivalency mappings. And what AAPC did is they made a conversion tool for you. And it's free. You don't have to pay for it. What this does is this will take your ICD-9 code and convert it to an ICD-10 code. Now, for those coders out there, as you know, if you're looking up a code in the alphabetical index of an ICD-9 book, you don't take that code out of that book and put it on your claim. You always have to go to the greatest level of specificity. And what this tool this tool will be helpful for is to find the location in the book. It'll just give you a roundabout, a round area. It will probably give you the unspecified code, and then you go into the book and you look up to the greatest level of specificity. Let me give you an example. Let's take a common code, 250.00, and we all know that, most of us know that that's diabetes. Now, after this converts, it will show you, okay, we have E11.9, type 2 diabetes mellitus without complication. Now, the patient might have some kind of complication. This will just tell you where to go in the book in the E11.9, and in that area you'll find the codes with the greater level of specificity. As you can see here, this was a 1-to-1 match. Let's put in a code, 781.3. And it converts that code to 3 codes. So what you have to do is you'll have to, if you want to use this tool, you go in, put in your ICD-9 code, convert it to an ICD-10 code, and then go to the greatest level of specificity. So that is a very good tool. Okay, let's go back to our presentation. Okay. Another great source of information is AHIMA, and that they are one of the partners with CMS for this conversion training. Okay. Planning and preparation checklists, which are on our website and also on CMS's website, and they're also on AHIMA's website. Lots of information there. Also, what I show you, the American Academy of Professional Coders, their website, great source of information. Okay, and I showed you the translator, what that did live. The World Health Organization, International Classification of Diseases, that is who owns those ICD-9, ICD-10, all of those diagnosis codes. General equivalency mappings, those are located on CMS's website, and I'll take you out there. I'll show you exactly where those are. Okay, we'll go back to our CMS's website. Guys to catch up. Now we click on Medicare, and then we scroll down, and on the left-hand side, under coding, we click on ICD-10. And if you see here, under 2014, ICD-10, CM, and GEMS. This is where you get those general equivalency mappings. And you can download those files. Maybe if you have a larger practice and you have technical folks, they might be able to create something for you, like what's on AAPC's website. You know, these are really not very user-friendly. These are more like technical specifications that you know, your techie people in the office may be able to use. Okay, make them useful for you. Crosswalking between ICD-9 and ICD-10 fact sheet, and that is on the AMA's website. If you want to read the final rule about the HIPAA that ICD-10 is involved with, you can read the final rule. Okay, and I told you where to find these resources. And what is very important with this transition is that you keep up to date with the changes and what's going on. I don't know if any of you heard before today about the testing that went out on a listserv or an email update. Okay, so if you knew about that, if you knew about that before, congratulations for signing up for the email updates. If you did not, please sign up for the email updates. These are a lot of changing times with the Medicare program, and we encourage you to sign up for the email updates so that you have the latest information available to you at your fingertips. And as we saw on CMS's website, we want you to fill out the website survey to tell us what you think about our website. If you're having problems finding something on our website, this is the avenue to go through. And also, this is a very good time if you get this survey, because if you've noticed, if you're familiar with our website, we have been updating because of what you told us you wanted. So please, we do hear you. Now I'd like to turn it over to your organizer, Michelle Poulos, and she will conduct the Q&A for us.
Okay, thanks, Alicia. And thanks, Arlene. Great presentation, lots of great information. If you give me one moment. Okay, I'm going to open the lines up for questions. And I just want to review with you on how you can ask your question today. Again, you have the two options. So you can send your question through that question box, okay, or you can raise your hand to ask a question verbally. Just remember that you have to have both microphone and speakers connected to your computer to ask your question verbally. Okay, and then how do you know if your hand is raised? Remember that the green arrow indicates your hand is not raised. So you want to click this button to raise your hand, and then the red arrow indicates your hand is raised. Okay, so we have some questions here. All right. Let's start with the first one from Jamie. It was mentioned to update our HIPAA policy. Why is this?
Anything that you have, with your HIPAA policy, if that any of those have ICD-10, ICD-9 codes on them, if for any reason that you have ICD-9 codes on any of the HIPAA information that you have, it will have to be converted to ICD-10. For anything that your patient signs, Privacy Act, if the patient, anything that you have to give to the patient that has an ICD-9 code on it has to be updated with an ICD-10.
Okay, great. The next one is from Matthew, and it looks as though he's referring to CPT codes and not diagnoses. How do we bill for observation services that span 9/29 through 10/2?
Okay. Now, for that question, all right, observation services, though that is Part A. Okay, this is a Part B seminar, but I can answer that question. Now, for an inpatient claim, you put in whatever code is for the date of discharge. So for this instance, you would use, if the services span from 9/29 to October 2nd, you would use ICD-10, the date of discharge.
Okay, we have a question from Pam. Will reimbursements be affected? Will reimbursements be affected, I guess, due to the diagnosis code, she's asking?
With the change to ICD-10, I'm assuming that you mean, the codes will work the same way. Your reimbursement is based off of your CPT code, not off the ICD-9 code.
Yes, based off the physician fee schedule, which is CPT.
Great. We have a question that's asking, what is the new HIPAA form, and where can we find that for download?
Any HIPAA forms that you have, those, if you have those in your office. There aren't any new forms. The only new form that there is to incorporate ICD-10 is the new CMS 1500 form.
Okay, thank you, Alicia. Let's move over to the phone lines. Okay, we have some questions here. And the first one is from Shakima. I'm going to unmute line. Hello? Okay, hello, Shakima, can you hear us? Did you have a question?
No.
Okay, that's not working. Let's go back over to the chat questions. We have a question from Lauren. Are there any coding books that are specifically recommended by NGS CMS?
Not that I'm aware of. We don't recommend any books. You can just Google it on the internet for the ICD-10 books. Alicia, do you have anything on that?
Because a lot of the books, even with ICD-9, there are different publishers, and they have different. It depends on what you need, what the needs are of your office. Some of them have lots of charts and medical figures of skeletons and things like that. And some of them don't. So pick the one that best fits your needs.
Okay, great. We have a question asking about printing the copy of today's presentation. So for those of you that did not hear the beginning, what you need to do is go out to our website, njsmedicare.com, and you want to go to the training events calendar. And I have the screen up here. And what you're going to do is look for today's session. Okay, find that session, and you see this here by the arrow. You're going to click on that link, and then you'll be brought to the events details page. And as you can see here, the attachments for the event, and then you just want to click that that link there, and you'll be able to either print or save that to your computer. Okay, let's get back to the questions. Okay, for an ambulatory surgical center for outpatient surgery, is there any specific help guides like you have for small or large practices?
For an ambulatory surgical center for outpatient surgery. Now that depends on whether you submit your claims to Medicare Part A or Medicare Part B, but if it's a Part B claims, you could use those guides that I had showed you earlier, where to find those. And if you're considered like a small hospital, there's also that guide there as well. And Barbara, if that's not specific enough, I don't know whether or not you're on the phone or if you can ask your question verbally. If you want to be more specific, we can unmute you, or you can be more specific and type that in.
Okay, great. Let's go back to the phone lines. I see Sandra has her hand raised. Sandra, I'm going to unmute your line.
Hello.
Sandra, would you like to ask your question?
Yes. How will claims process prior to the 10/1 date with the ICD-9 codes be affected if they have to be reprocessed after that date? I know sometimes the carrier can reprocess the claim that they have on file.
Like I said, Sandra, though, it does go by the date of service. So for your Part B services, your diagnosis code is going to go by your date of service. So if your date of service is September 28th, you're still going to use your ICD-9 codes.
Okay, so even if the claim is reprocessed after that date, they'll still accept the ICD-9.
Right, because it goes by the date of service. Your date of service is still September.
Yeah, and
great. Okay.
And that's why you have to make sure that your software can accommodate both ICD-9 and ICD-10 for a period of time until all of your claims prior to 10/1 have been resolved.
Wow. Okay. Okay, thank you very much.
You're welcome.
Okay. Let's go back to the chat questions. Matthew was asking, how do we get prior authorizations before 10-1 for services post 10-1?
Right. Medicare does not give prior authorizations, so that's a question that you have to contact your other payers about.
Okay, thanks, Alicia. We have a question from Lori. She's asking about testing week. If I want to participate in ICD-10 testing week, should I contact my vendor to make sure they are participating as well?
Yes, Lori, when I went over the vendor slides during the presentation, you definitely want to make sure that your vendors are doing what they're supposed to be doing and they're going to be prepared for ICD-10.
Okay, thanks, Arlene. We have a question from Lisa. When will the medical policies be updated with the ICD-10 codes?
That was on slide. Let me just go back and look. But that's going to be April 10th. The ones that have ICD-10 codes associated with them will be updated April 10th, and then the ones that are not associated will be in September. I'm just going back to see what slide that was on.
Okay.
Okay, that was on slide 20 of the presentation. So it was in MedLearn Matters article 8348. And those will be updated on the Medicare coverage database no later than April 10th.
Okay, great. Kim is asking, if you are a small group and have a vendor, do you have to do a test on your own?
I think the vendor would be responsible to do your testing. So, I mean, it's up to you what role you want to take in that. But as I mentioned on the slides that I went over for the vendors, you just want to make sure, as I said, that they're doing what they're supposed to do. And you want to make sure that if there is any updates, what kind of updates there are, if you're going to be responsible for any kind of charges for those updates, if they're doing a crosswalk from ICD-10 to ICD-9 to ICD-10, you know, what it's all going to entail for you. So you would have to contact them.
Okay, thanks. And we have another question regarding testing. Testing registration. We have a biller in our office and a clearinghouse. Is it recommended for both tests? And I believe you just answered that, Arlene.
Right. Mm-hmm.
Okay. All right, let's go to Vicky's asking, are the alphanumeric codes case sensitive?
No, they are not.
No,
No, they're not.
Okay. All right. Linda is saying, could you repeat the website for the ICD-10 translator? She said thank you and great presentation, but she'd like for you to repeat that website for the translator.
Okay, you want to give the presentation back over to me and I'll show them?
Sure.
Now, their website is www.aapc.com. Okay, and when you get to there, okay, what you would do is you would just click on ICD-10 on the top navigation, click on ICD-10, and over here on the right-hand side, you click on ICD-10 conversion. I did, and I just saved it. I just saved it as a favorite. Okay. And what you do here is you just put in your code, and then click on Go, and it will convert that for you. And this, like I said earlier, this tool is based on the general equivalency mapping, published by CMS. Okay. See here, they have the disclaimer right here on the bottom. Keep in mind that while many codes in ICD-10 map directly to codes in ICD-10, a clinical analysis may be required to determine which code or codes should be selected for your mapping. Always review mapping results before applying them. So, there it is.
Okay, thanks, Alicia. Amy is asking, they have a small practice of 2 providers and 1 PA. We use a clearinghouse and vendor. She's asking, are they to find out if they will be ready for processing claims?
They should know whether or not they'll be ready, but you should contact them and find out if they're ready. Don't assume that they're ready.
All right. Maria is asking for testing week. Do we just submit the claims to the various insurances just to make sure our systems are set up correctly?
Now, this testing week is just for Medicare, not for the other insurance companies.
And again, for that testing week, you had to register for the testing week. You have 2 days left to do that.
Okay, great. Vicki is asking if our vendors are ready, and we are ready. Can we start using the ICD-10 prior to the 10/1/14 date?
No, Vicki, it will not be effective until October 1st, 2014. That's the date, the compliance deadline date, and that's the date that those codes will be effective. Prior to that, you're still going to use ICD-9.
Okay, thanks, Arlene. Pamela is asking, is there a crosswalk ICD-9 to ICD-10 for just mental health?
That's something you'd have to go back to your specialty society for. I did hear something that there might be the DSM codes translating over to the ICD-10 codes, but that wouldn't come from us. That you'd have to go back to your specialty society for assistance.
Okay. Tina wants to know, is there ICD-10 codes that's not otherwise specified?
Yes. Yes, they are also in there along with the more specific ones. But if you're a practitioner or, you're non-physician practitioner, whoever, the caregiver, the person giving the care, and be more specific, because that's what they should always, the documentation it should have always been specific, but the ICD-10 drives the providers to be more specific in their medical record keeping. Okay? Like the documentation, if you've always been very specific, that is great. But if not, you have to tell the provider of services they have to be more specific in their documentation. But there are not otherwise specified codes.
Okay, thanks, Alicia. Let's go back over to the phone lines. We're going to unmute Denise. Okay, I see she's on a headset. Hopefully she does have a speaker. Denise, we've unmuted your line. Okay. We will look to see if she also chatted a question. We have a question from Lori. If codes have to be 6 characters long and we use ICD-10 code E11.9, do we need to put X's after the 9 to make it 6 characters?
No, you do not. And all codes do not need to be 6 characters for ICD-10. They can be in the range of the 3 to 7 characters. Okay, and that was, going back to my slides again, 1 second. Slide 22 gives you the diagnosis comparison. Okay, so it can be between 3 and 7 digits. And you're not going to add the extra characters just like you wouldn't add them for ICD-9. You're not going to do that in ICD-10 as well. They just have the X's as placeholders when there's going to be future expansion, or for the other codes that are 6 digits that are not 6-digit in length but do require 7-digit. Okay, and you'll see that in the ICD-10 book in the beginning of the chapters. You'll see some chapters do have codes that require 7 digits, but they don't go all the way out to 6 digits, so that's why there's X's for those additional places, so they can accommodate that 7-digit field.
Okay, thanks, Arlene. The next question is from Cynthia. If we want to use more than 4 diagnoses, For one CPT and ICD-10, will there be space to report this, or should we limit it to the top 4?
Now, with the new, with the upgrade to 5010 that occurred last year, and the incoming, which everyone should be using now, the new 1500 claim form, there are additional areas. There's more than 4 now. I believe Andrea is on the line. Andrea, how many new spaces are there on the claim form for the new ICD-10 codes?
Let's see.
I mean, even though there's additional spaces for it, we would still follow the same rules we follow today, that we're going to take the primary diagnosis of that condition, especially if you're using an LCD, so there's policy that you have to follow, and it does require a specific diagnosis on it. You want to make sure that that diagnosis is on that specific claim for that procedure code. You know, all the other diagnoses, if they're, you know, underlying conditions or something you're not treating the patient for on that day, that should all be back in your medical record.
But really, you should only be putting the diagnosis on the claim that you're treating the patient for.
Okay. Let's see, we have a question from Lana. Besides utilizing the new ICD-10 codes in the diagnosis field, will the structure of EDI files need to be changed?
They already have been. When you converted from 4010 to 5010, that's what that was the reason for that conversion, is to be able to enter in ICD-10 codes. So that's already been done.
Right, I discussed that on slide 15, that it was they increased the field size from 5 bytes to 7, and they added the 1-digit version indicator for the ICD codes to indicate version 9 versus 10. And it increased the number of diagnosis codes that they'll allow on a claim.
Thank you. I just got from one of our panelists, there are 12 A through L on the new claim form.
Okay, perfect. And we have a question asking, are there any ICD-10 codes which are also ICD-9 codes? In other words, is there any chance of confusing them?
I haven't been through the ICD-10 book. I did hear that could happen, that there are codes that did stand for one thing in ICD-9 and may stand for something else in ICD-10, so you do have to make sure that you're looking at your codes very carefully.
Especially the ones that start with a letter, because all ICD-10 codes start with an alpha. The ones that start with the number, they won't be duplicated.
Okay, we have a question from Brenda. When educating physicians on ICD-10 code selections to choose from, using the example of the lymphoma code, which is an ICD-9, this is very specific, is 202.0, and there are 100 in ICD-10. Is it expected that the physician select more than one ICD-10? Also, are there reimbursement or auditing issues that could arise with not selecting the exact ICD-10 code?
There are 202.0. Let's put that into the code translator. 202.0. And we don't even see that code in here. I don't suspect that there would be 100 matches to one diagnosis code. But I'm not saying that it's impossible, but the doctor should, and the coder should, be in communication with each other. If there is that much of a code range of selection, the coders be in contact with your physician and have him help you select the most, to the greatest specificity.
Okay, perfect. We have time for one more question. We are at the top of our hour. Do I have to sign up to do the ICD-10 testing myself, or does my EHS company do it?
All right, since the claims come in, you put them in through your, like, a clearinghouse. I don't know what an EHS is. Do you know what an EHS is, anybody?
Like, is she referring to the EHR?
Well, anything electronic, if your claims don't go directly from your office to Medicare, which none of them should, you contact your vendor or your clearinghouse and find out with them whether they are going to be transmitting test files. That's a question that you need to ask your vendor.
Okay, great. And it looks like we are past the hour.
And I'll just take that question about the official ICD-10 code book. I can just
Or go ahead, Alicia. Go ahead.
Okay. Now, as Arlene had said earlier in the presentation, the last regular update to the ICD-9 and ICD-10, the last regular update was made on October 1st of 2011. Okay. October 1st of last year, there was only a limited code updates to both those code sets. Now, on October 1st, the same thing of this year, there will only be a limited updates to ICD-10. So there will not be an official book out till sometime prior to October 1st, but if you have a 2014 draft book, there should not be too many changes, all right? Because like I said, there is a code freeze. And then on October 1st, 2015, the regular updates to ICD-10 will begin again. So if there are any updates, it will be very, very few.
Okay, thanks, Alicia.
Hey, that's it.
Okay, this concludes today's session. I just would like to mention that you're all going to be receiving an email in about an hour or so, and this will provide you with your course code catalog number if you want to self-report this session in Medicare University. Also, to receive your CEUs from the AAPC, that email will serve as your documentation of attendance, in which they will assign you an index number for that. So that's something you have to bring to your accrediting organization if you are a certified coder. Okay, and I'd like to thank the presenters for a great presentation, and thank all of you for attending today, and have a great day.
The organizer has ended the session, and this call will be disconnected.